Hey everyone, my name is Sienna Boyd and I am the community rep at Rancho Family Medical. And today we are in the Choose Health studio with Dr. Rome Walter, who likes to be called Dr. Rome. And we will be diving deeper into mental health, specifically anxiety disorders today. But before we begin,
Sure.
Can you just introduce yourself a little bit, tell us more about your practice?
Yeah, of course. It's a family practice. We're out of the office at Cal Oaks, and I've been doing this for over 10 years. I have a pretty
Nice.
broad practice, and some people know me as just more holistic oriented. I don't know if
Okay.
I love that title. We just try to find the best medicine. We try to find fundamentally what's going on with people, and lots of times lifestyle, and it has a lot to do with that. And so
Definitely.
I don't consider lifestyle alternative, but getting into nutrition, getting into good sleeping habits and mindfulness, and using nature, using supplements where appropriate,
Definitely.
can be a big help.
Definitely.
Yeah.
Wonderful. Well, we want to dive right into anxiety disorders, mental
Yes.
health. Can you tell us some of the anxiety disorders that you come across on your day-to-day?
Yeah, of course. You know, obviously generalized anxiety disorder. This is where people are just anxious all the time, and everybody's a little anxious. That's
Sure.
important. I
Going
think.
up on stage, have butterflies.
Going up on stage,
Definitely.
or just sometimes the day can seem kind of overwhelming.
Sure.
We're wired to be anxious. If we were,
Interesting.
from an evolutionary standpoint, if we were too relaxed, we wouldn't work hard to be careful or survive. So
Sure.
we're supposed to be a little uncomfortable, a little bit looking for what's wrong.
Oh, okay.
But in today's society, there's not really a tribe going to attack us.
Very true.
and
A lion right behind
There's
us.
not a lion. We're not going to get our food. So
Sure.
now a lot of this feeling of disease, this feeling of what's wrong, it's just
Sure.
not functional. And
Right.
so the big thing, though, is that if it interferes with your relationships,
Right.
if your inability to work or enjoy yourself with friends, now
Right.
it's become maladaptive, and now we start talking about this is kind of a disorder. You're not
becoming, yeah.
balancing it with anything.
Your day-to-day life is
Yeah.
getting impaired by this
Yeah.
disorder. Okay.
But then, of course, you got panic attacks. So this is where you just, for no reason whatsoever, just have this overwhelming feeling of tightness or alarm, something's wrong.
Sure.
Lots of times people will think they're having a stroke or a heart attack.
Right.
They're often young and healthy, so that doesn't really make sense for most of the time. And then it goes on and on, fear of places, fear of public
There's
speaking.
a whole list of different.
There's a
Yeah.
whole list, and also sometimes it's other mental disorders. If you can't focus at all, you can't get anything done, you can't stay on track, then after a while you just start getting nervous about doing anything. So sometimes you got to be careful and understand that it could be something else that looks like anxiety.
Absolutely. That is very true. I know oftentimes anxiety and depression can get confused.
Right.
Can you tell us the differences between those two? The main
Sure.
differences?
Sure. Well, one, there's a lot of crossover, and so
Okay.
a lot of the treatments for depression work for anxiety.
Oh, really? Okay.
Yeah, sometimes they're the same.
What are some of the symptoms of both?
Well, the feeling that there's something wrong all the time and not being able to enjoy some things or being afraid of things all the time can give you a sense of just sadness or being overwhelmed
Sure.
or not wanting to do anything. But of course, that's how you feel when you have anxiety as
Right.
well. So like you say, there's a lot of crossover.
A lot of crossover, yeah, definitely. What are some of the biggest tools that you would tell your patients about how to mitigate those symptoms of anxiety or depression and ultimately how to cure them?
Yeah. The first thing I would say is you really have to face it.
Okay.
There's still a little bit of a stigma about it being mental health issues, including
Yeah.
anxiety. So a lot of times people will try to talk about it, I'm here for this, this, and this, and then towards the end, by the way, I have anxiety. You got anything for that? Well, anxiety goes pretty deep, and if you have
Right.
problems with anxiety, likely your whole life you've had layers of probably maladaptive learning behaviors and
Interesting.
habits.
Okay.
And so it's not something that you're just going to, by the way, fix.
Okay.
And if you want to get the best treatment from your physician or provider, you really need to focus a visit or 2 or 5 on
Wow.
anxiety.
Okay.
Because we have to make sure there's not some kind of underlying physiological reason for it,
Right.
thyroid disorder or host
interesting.
of, a nutritional deficiency, and you got to realize that it's years of maladaptive beliefs that you've
Okay.
built up, that you're telling yourself these catastrophizing ideas about the past and the future.
Right.
So it's not going to be erased in one day. It's not going to be erased with
Sure.
one pill. So focus on it, not stop everything, but give your physician the best opportunity to really help you
Okay.
by knowing that you're going to need a few visits, especially in today's modern 15-minute visit
Sure.
situation. You're going to have to dedicate a few visits to it.
Definitely. I think something that you mentioned was really interesting, how you had said there's anxiety, but there also might be some physiological things happening. Do you see
Yeah.
often that people who come in with anxiety, it could be a chemical imbalance or something going on nutritionally, maybe they need to exercise more, or is it mainly situational anxiety?
Yeah. So I always start with looking for some kind of underlying cause
Okay.
because it's more simple, straightforward, and
Sure.
it's kind of a cure or fix.
Yeah.
Most of the time, that's not it.
Okay.
Most of the time, this is a genetic predisposition and some kind of learned behavior with, childhood or early adulthood with some experiences that kind of compounded those genetic predispositions.
So-
and it runs in the family. You'll see that a lot.
Okay, I did not know that. I didn't know that anxiety or depression or anxiety disorders were hereditary, for a lack of a better word.
Absolutely. There's a lot of
Wow.
evidence that there's a lot of a hereditary component.
Okay.
It doesn't mean you're going to have it or that there's no
Sure.
treatment for it. It just means that if not caught early, or if there's a lot of opportunities again to build this maladaptive belief system or
Right.
behaviors for something that you're basically born with.
Oh man.
I would say it's not. People need to know it's not their fault, and sometimes
Right.
they feel like it is my fault. I'm too much this. I'm too much that. I'm
man.
a worrywart.
Which then adds to the anxiety.
that doesn't
Oh
happen.
man. Self-fulfilling prophecy then.
Yeah. I think you're right.
What are some of the tools that you would tell your patients who come in with anxiety or depression, maybe some practical tools they can do to mitigate those symptoms and mitigate those feelings?
Well, to get back to what you talked about, there is times where lots of times people are doing pretty well. They
Okay.
do have some coping strategies that are helpful that they have.
Right.
But there'll be a situation where they don't have their normal coping strategies. For example, gyms closing during the
Sure.
pandemic, or friends or family that actually made life great for them and then they moved or something happened. And so now they feel like, oh, there's something wrong, when really they just need to go back
Absolutely.
to those basics. But as far as treatment, like I said, it should be taken seriously, and there's 3 general categories that do work for
Oh, okay.
anxiety. One, meditation.
Meditation.
Meditation works. It's not for everybody, or it's
Okay.
not for everybody at every moment in their life. They may
Right.
need something different or something in addition to meditation.
Right.
Therapy.
Meditation,
Really having a good, cognitive behavioral therapist or similar therapist that
Yeah.
really
Okay. Definitely.
is this safe place where they can say whatever they want, they can
Right.
reveal whatever they want, and they can really examine their beliefs or their
Okay.
thoughts or how they're looking at things. And finally, medicine. Medication, either kind of an as-needed medication, as if it's only every once in a while, like these panic attacks, or daily medication.
Okay.
There's no perfect answer. All of these either take work or patience to explore, for example, side effects of medications or the
Right.
right one that works for you. Therapy can be uncomfortable,
Absolutely.
There's reasons why people's anxiety gets worse, and so to talk about those doesn't make you feel better, so why would you want to do something? You want to feel
Right.
better, but then you're doing something that doesn't make you feel better.
Oh, right.
And then meditation's the same thing. People who have a lot of anxiety are not going to feel better doing meditation right away. They're
Right.
going to feel really uncomfortable, but of course that's the best place to practice.
Right.
If you can handle the thoughts and the discomfort of not being distracted, then you're going to do a lot better during the day where you have a lot of coping strategies.
Right.
you get distracted at work, you're just keeping your mind off it, exercise, these are all potentially healthy.
Sounds like there are a lot of tools in your arsenal that you can prescribe to your patients. And I know you were talking about having a holistic view and taking your patients and being able to intentionally narrow down the tools that would work best for them individually, which is pretty cool. I know you had mentioned that gyms are closed right now due to COVID and just the season that we're in. Has there been a rise in mental health issues with your patients since COVID?
Yeah, I would say definitely.
Definitely, okay.
A lot of people are coming in who they've had anxiety for a while, but through whatever coping strategy, or they just have a really good life situation, they're able to manage it. And it wasn't becoming something that, like we talked about, was keeping them from working,
debilitating,
or causing undue strife in a relationship. So they were getting by until COVID, and it's not just COVID, it's just being home all the time and then looking at media, and there's so many things going on, and you can't control it, and yet you feel either responsible or you feel like something's wrong.
Definitely.
It definitely looks like something's wrong with the world, and so then that just snowballs into this feeling that something is wrong. And I think that's the main that's the main bad belief that people have, that somehow things aren't going the way they're supposed to go. And so getting them grounded with a therapy is important.
Therapy is important, especially in this season.
Well, and I always usually recommend a combination of these therapies, not just one, because lots of times people just aren't ready for change without a medication, even though they might have a great therapist, and they might see in the therapy that their beliefs are dysfunctional, are putting them in an uncomfortable state, that they're seeing things that are wrong with their past and future that really are just the way things are. But they can't really change those behaviors until they're under the influence of a medication, or the medication works, but if you don't change your mindfulness practice, you don't change your lifestyle, after a couple of years you might get used to that medication, and you've wasted an opportunity to really structure your lifestyle and really do the work of evaluating your beliefs and creating more of a long-term solution for rather than just medication.
Yeah, that makes complete sense. Well, one word of advice that you would give to your patients right now during this COVID season, when they're in isolation, what are some practical tools you would give them to help mitigate those feelings, especially right now in isolation, seeing all of the news, being bombarded with bad news every day? What are some tips and tricks that you would give those patients?
Sure. That's my personal bias, but I do think everyone benefit from just 10 minutes of meditation every day. And luckily there are a host of great apps online that help guide you through it.
What's your favorite?
The one I'm using, I don't know if I have a favorite. The one I'm using right now is called 10%. So it's after the book 10% Happier by Dan Harris. It really is for the beginner. It really is for anybody. They could be advanced too. I find that the sessions are small enough. They give you a little learning tidbit, and then they go right into a guided meditation for you to do. And very practical, very accessible. There is a little cost with that one, not much. Definitely worth your mental health.
Very much so.
I also like Insight Timer. I use that one just basically for a basic meditation timer, just so you keep your sanity. You get a little bell every once in a while to know you're gonna make it to the end. It's not supposed to be an endurance, sporting event, but when you're first starting, you're not used to it, and sometimes you just want it to be over. So Insight Timer is great. There's some free options, which I use, and then there's some payable ones. And so those two are a great place to start.
Well, thank you so much for giving us those suggestions and just for being here and talking to us about mental health. Dr. Rome is seeing new patients at our
Cal Oaks.
Thank you. Yes, exactly. Dr. Rome is seeing new patients at our Cal Oaks location. So if you are interested in seeing him as your doctor, you can always give us a call or contact us. Thank you again so much just for being with us and sharing your knowledge today.
You're welcome. Thank you.